Well, I'm pleased to be joined at the Spencer Academy in Ingersoll by Dr. Connor Bryant. Welcome.
Hi.
First thing, we've had these air filtration machines installed here. For the benefit of our viewers, tell us a little bit about what your machine does.
Yeah, so the unit itself is actually developed for dental surgeries. I'm actually a dentist by trade, and we could find that there's a lot of things in the air that are produced not just by the dentist, but everyone coming into your dental practice. So we actually looked in developing a unit to remove that from the air well before COVID actually hit. And it wasn't until COVID that everyone started taking air quality seriously. And we have been inundated with people that wanted these units outside the dental world, specifically in hospitals. So these units are in hundreds of hospitals up and down the country. And then now more so places like schools where you've got a large gathering of young children bringing numerous colds and flu and things into that classroom. And people have reached out to us to say, do we have the ability to remove that from the air? And what we found is that the schools don't have the budget to be able to afford these units. So we thought we'd do sort of a pilot study here to work out whether we can make a big difference. And from the initial feedback that we've got so far, it seems to be making a big difference. The units themselves are really a medical unit, so it means they're kind of overqualified to work in a classroom. But it means that it's going to be quite quiet. So a lot of the units on the market will make quite a lot of noise, which can interrupt education. Whereas with something like this, it's got a lot of sensors in it. It's very clever. So it's never going to run louder than it needs to. And a lot of the time you'll probably find that the unit will suddenly make a lot of noise because it's detected something in the air that it deems a threat, and it has to remove that. So when it's making noise, it's protecting you. But it's always running in the background to make sure that everyone in the classroom is protected.
Dr. Bryant, as your company have gone around the UK working with different schools, doing what's called evaluation of what a school needs, what have been some of the key learnings about the level of support that a school needs that it's probably not currently getting?
I think so far the advice that schools have been given has been extremely vague. So a lot of the time, I think the biggest widespread knowledge is the introduction of CO2 monitors, which is a method of determining how stuffy a room is. So the theory goes that if there's a lot of CO2 in that classroom, there's been a lot of people in there, a lot of people breathing, and therefore the level of CO2 goes up. It doesn't do anything for that. It just tells you that you now need to open windows. And the guidance is saying you need to open windows and doors anyway. So really the CO2 doesn't help in any way. It just tells you need to do something. And as Sarah mentioned, with the opening doors in the middle of winter when you're trying to pay heating bills anyway, it's not a solution to COVID at the moment. And that's about as far as I can tell the guidance has gone so far, that you need to open windows, but that's about the only solution we can come up with. And actually, that's not really a solution to the problem, because some classrooms you can't open windows, so what do you do in that situation?
So I guess I can conclude from that, Dr. Bryant, that the £25 million that the government spent on CO2 monitors, some of which we know have not even been plugged in, would have probably been better spent on an air filtration machine?
Absolutely. This just tells you, the CO2 monitor is telling you there is a problem. It's not solving it in any way.
Now, there's been a lot of focus on COVID-19, and we heard from MP for Chesterfield, Toby Perkins, his research has shown that there's more for us to worry about in our air, in indoor air in our classrooms than COVID-19, something known as PM 2.5. What is your research telling us about that, and why is that such a concern for schools in the United Kingdom?
Absolutely. So PM 2.5 is talking about particles which are suspended in the air. And they're so small that you certainly can't see them. And so you don't really know they're there. And testament to that, as we went and plugged this machine, which is below me, we plugged it in, the machine instantly went red and kind of then sort of turbocharged itself to say there's a lot of stuff in this room that shouldn't be in there and we shouldn't be breathing it in. The WHO guidelines stipulate that level should be below 20 particles per cubic meter. And with this machine, it was saying it was in the hundreds when we came into this room. You'd have no idea that that would be the case unless you had a unit that's going to read that and then be able to remove it. So there's so much more in the air. And even when you open a window, outdoor air quality, especially in a sort of an urban setting, isn't any better. So actually all you're doing is introducing smog and diesel fumes and things coming into the window. So all of these things, which is set by the WHO, a lot of the time it's above that line anyway. And again, we have conducted another small pilot study to show that with introduction of this unit, we can comfortably keep it below the WHO guidelines in a normal classroom size with just one unit. So it's not about COVID anymore. It's genuinely about general health. And we know that above that 20 mark, other health risks come into play.
And to quantify the size of the problem, Dr. Bryant, according to a survey from Global Action Plan, 25%, more than 8,000 schools in the UK have air quality with a PM 2.5 level that's above the minimum safe level recommended by WHO. Final question, Dr. Bryant. How satisfying has it been for you as an organisation to be able to help a school in need like Ingersoll Spencer Academy here in Derbyshire?
It's really great. I hear a lot of feedback through my team that have come and said that, these guys are really grateful for the units. And when I hear things like they've actually managed to reduce the the level of sickness within their class, and that they haven't had a COVID case within those classrooms since they've installed the unit, it's just really great to know that we can sort of give back to the community, especially in these schools that can't afford to put these in. Especially when there's such a clear distinction between having a unit and not having a unit, and there's just got to be something to do. And we've been able to do this in a small way. We've managed to donate 10 of these units to the school, and they're being well utilised.
Well, on behalf of the Air Purification Trade Association and the MP for Chesterfield, Toby Perkins, and Sarah Allison, the head teacher, I'd like to thank Medicair for the support you provided to this school.
Thank you. My pleasure.